Welcome back, everyone. Today, we're going deep into Creutzfeldt-Jakob disease.
CJD, yeah.
As medical microbiologists, you're probably familiar with all sorts of infectious agents.
Right.
But CJD, this one, it's a bit of a different beast.
It definitely presents some unique challenges.
We've got some great sources lined up for this deep dive. Microbiology, the CDC, Microbe Canvas. We're going to really unpack this.
Absolutely.
All right. So get this. You can actually get CJD from contaminated surgical instruments.
If they haven't been properly sterilized, yeah, that's a real concern.
It is. So let's break it all down.
Thanks.
First things first, what exactly is CJD?
Well, in a nutshell, CJD is a really rare and fatal brain disorder.
How rare are we talking?
Affects about 1 in a million people each year.
Wow.
And sadly, the prognosis is pretty grim.
How so?
90% of folks diagnosed with CJD, they don't make it past a year.
That's really heavy.
It is. It's a very serious condition.
So what kind of symptoms would you see in a patient with CJD?
Early on, it can be tricky. You might see memory problems, changes in behavior, maybe some difficulty with coordination.
Kind of like general neurological stuff.
Exactly. But as things progress, those symptoms become much more severe.
Like what?
You're talking dementia, involuntary movements, blindness, weakness.
And eventually?
Coma, and ultimately death.
So during all of this, what's actually going on in the brain itself?
One of the key features of CJD is something called spongiform degeneration.
Spongiform, like a sponge.
Yeah, literally. If you look at the brain tissue under a microscope, it actually looks like a sponge.
That's kind of disturbing.
It is. There are all these tiny holes where neurons have died.
And that's what causes the neurological decline.
Exactly. The brain cells are progressively destroyed, leading to all those devastating symptoms we talked about.
Okay, so let's get to the root of the problem here, the culprit behind all this, prions.
Right, prions. These are, they're unlike anything you typically deal with.
I mean, we're talking bacteria, viruses, that kind of thing.
Yeah, prions are different. They're not living organisms. They're misfolded proteins.
Misfolded proteins, what does that mean?
So proteins have a specific shape, right?
Right.
And that shape determines their function.
Okay, yeah.
But prions, these proteins are misfolded. And the scary part is they can cause other normal proteins to misfold as well.
Kind of like a chain reaction.
Precisely. It's like a domino effect of protein misfolding.
So it's not like viruses or bacteria that replicate, they just kind of corrupt existing proteins.
Exactly. And these misfolded prions, they clump together.
What does that do?
Well, it disrupts the normal function of neurons and eventually leads to cell death.
And the real kicker, prions are incredibly tough to get rid of.
They're incredibly resilient.
Yeah. I was reading Microbiology, and it mentioned that you need some pretty extreme measures to inactivate them.
Absolutely. Standard sterilization techniques, they're not enough.
Like, what kind of measures are we talking about?
They mention autoclaving at 134 degrees Celsius for a full hour.
Wow.
Or using sodium hydroxide.
So serious stuff.
Yeah. Prions, they really raise the bar when it comes to infection control.
Absolutely. So knowing how this thing spreads is crucial, right? For prevention and all that.
Absolutely crucial.
So let's delve into transmission routes. We know there are 3 main ways CJD can happen.
Right.
Sporadic, familial, and acquired.
You got it.
Break those down for us.
Okay, so sporadic CJD, that's the most common. About 85% of cases.
Okay.
And it seems to just pop up out of nowhere. No clear risk factors, no family history.
So just bad luck, essentially.
Pretty much. It's like a random prion protein just decides to misfold.
Oof. All right. What about familial CJD?
Familial CJD, that's driven by genetics.
Okay.
It's caused by inheriting a mutated prion protein gene.
So if someone in your family has it, your risk goes way up.
Significantly higher, yeah. And unfortunately, if you have that mutation, there's no way to predict or prevent it.
That's tough. And what about acquired CJD? This is the one that's particularly relevant for our listeners, right?
Yeah. Acquired CJD is relatively rare, but for healthcare professionals, it's a huge concern.
Why is that?
Because it can be transmitted through medical procedures if contaminated materials are used.
Like what kind of procedures?
Certain types of transplants, like corneal transplants or dural grafts.
Dural grafts, that's a type of tissue used in brain surgery, right?
That's right.
And then, of course, there's the contaminated surgical instruments we mentioned earlier.
Right. And because prions are so resistant to conventional sterilization, that's a real risk.
The CDC actually documented a case where CJD was transmitted through contaminated neurosurgical instruments even after they've been sterilized.
Really drives home the point, doesn't it?
It does. So with all this in mind, how do you even know if someone has CJD? How's it diagnosed?
Early diagnosis is really tricky.
I bet. Those early symptoms are so vague.
Exactly. Memory problems, subtle behavioral changes, coordination issues. Could be anything.
So no simple blood test or X-ray to check for CJD.
I wish it were that easy.
So what tools are there?
Well, there are some things that can help. EEGs, for example. Electroencephalograms.
EEGs, yeah.
They can sometimes pick up characteristic patterns in brain activity, but often not until later stages.
Right. What else?
Analyzing cerebrospinal fluid can be helpful.
From a spinal tap.
Yeah. You can sometimes find elevated levels of a protein called 14-3-3 protein in CJD patients.
Interesting. What about imaging? Can you see anything on, say, an MRI?
MRIs can show some specific abnormalities in certain brain regions that might suggest CJD.
But it's not always clear-cut.
Not always.
So if all these tests aren't definitive, how do you actually get a firm diagnosis?
Well, the most definitive way is through a brain biopsy.
Oof, that sounds invasive.
It is. It's not a decision made lightly. It carries risks, and it's usually reserved for cases where a definitive diagnosis is crucial for guiding treatment.
It's got to be a tough call. Speaking of treatment, is there a cure for CJD?
Sadly, no. There's no cure for Creutzfeldt-Jakob disease.
So it's a terminal diagnosis.
It is.
What can you do then?
The focus shifts to managing symptoms and providing palliative care.
Making the patient as comfortable as possible.
Exactly.
We've covered a lot of ground already in this first part of our deep dive. The nature of CJD, prions, transmission routes, diagnosis. It's a lot to process.
It is. And we're just getting started.
Indeed. We'll continue our exploration in the next part of our deep dive.
There's a lot more to unpack.
So stay tuned. We'll be back soon with more on Creutzfeldt-Jakob disease.
We'll see you then. So let's dig a bit deeper into these different types of CJD. We talked about sporadic CJD being the most common.
Right, the one that seems to just come out of nowhere.
Yeah, about 85% of cases. And we still don't fully get why those prion proteins misfold in the first place.
It's one of those mysteries of the brain, I guess.
Then there's familial CJD, which is all about genetics.
Inherited, right?
Exactly. You inherit a mutated prion protein gene, and your risk goes way up.
And if you've got that mutation, no way to know for sure if or when you'll get sick.
Sadly, that's the case. Now, acquired CJD, this is the one that really matters for our listeners, those in the medical field.
The contamination issue.
Exactly. Acquired CJD, it might be rare, but it stresses how important those strict infection control practices are.
Especially when you're working with anything that came from a human, right?
Absolutely. We've seen CJD transmission from things like corneal transplants.
And those contaminated surgical instruments we talked about. Chilling to think about.
Dural grafts, too. That tissue used in brain surgery, another potential source of contamination. The CDC even had a case where CJD was transmitted through neurosurgical instruments even after they'd been sterilized.
Makes you wonder if those standard sterilization methods are really enough.
It's a serious question to consider. Then there's variant CJD, or VCJD. This is the one that's linked to mad cow disease, right?
That's the one. Bovine spongiform encephalopathy, or BSE. So is it like COVID, coming from animals?
That's the thinking. Consuming beef contaminated with those mad cow prions, it's a zoonotic disease, meaning it can jump from animals to humans.
And VCJD is a little different, right?
Yeah.
Affects younger people, and the disease progresses more slowly.
You're right. And the brain damage patterns in VCJD, they're distinct from classic CJD, shows how these prion diseases can present in different ways.
Speaking of different, you mentioned Kuru earlier, the prion disease linked to cannibalism.
Ah, yes, Kuru. A fascinating, albeit unsettling example.
So this was happening in Papua New Guinea, right?
Right. Among the 4 people, they had this ritualistic cannibalism thing, consuming the remains of their deceased relatives.
And that's how the prion spread.
Unfortunately, yes. Especially consuming the brain tissue.
And Kuru mainly affected women and children.
They were more likely to consume those specific body parts during the rituals. It's a striking example of how cultural practices can lead to disease transmission and why understanding these links is so important for prevention.
Really highlights the complexity of infectious diseases, doesn't it? How factors you wouldn't expect could be involved.
Absolutely. And it underscores the crucial role medical microbiologists play.
Identifying those unusual transmission routes, protecting public health.
Exactly. Our expertise is more important than ever, especially with these tricky prion diseases.
Makes you realize there's always something new to learn in this field. So we've talked about the lack of a cure for CJD, which leads us to managing this awful disease. Palliative care is the focus, but what does that actually look like in the context of CJD?
Well, palliative care for CJD patients, it's a whole person approach. Managing those tough symptoms, providing comfort and support, not just for the patients, but their families too. It's about quality of life when you're facing a terminal illness. It really is about focusing on the whole person, not just the disease.
So it's not just about managing the physical symptoms.
No, not at all. It's much, much broader than that. You're addressing their emotional needs, psychological, even spiritual needs. It involves open communication, compassionate care, and recognizing that each patient, each person is an individual.
What kind of specific interventions or strategies are usually used in palliative care for CJD patients?
Well, medications can help with some of the more distressing physical symptoms, like the involuntary muscle jerks.
Oh, right, the myoclonus.
Yeah, anxiety, pain.
Pain management must be a big part of it.
Unfortunately, it is, especially in the later stages. For myoclonus, you might see medications like clonazepam or sodium valproate prescribed, and for pain, often opiates. But beyond medication, you have to think about creating a comfortable and supportive environment for the patient.
So like adjusting their living space.
Exactly. Making sure it's adapted to their changing needs, maybe they need assistive devices, and just creating a calm and peaceful atmosphere around them.
I imagine emotional and psychological support for the patient and their family is crucial too.
Absolutely. It's a tremendously difficult and stressful time for everyone involved. Counseling can be really valuable, and support groups too.
Having that space to share experiences, process those emotions.
Exactly. And connecting with others who are going through the same thing. Social workers can play a vital role, and chaplains too, offering that spiritual support.
So it's a truly holistic approach to care, recognizing that a person is more than just their illness.
Couldn't have said it better myself. Well, we've covered a lot of ground today. The ins and outs of prion biology, the different types of CJD, the grim realities of managing this incurable disease.
It's heavy stuff, but it's so important to understand.
I hope this deep dive has given you some valuable insight into the world of prions and the unique challenges they pose, especially for those of you working in healthcare.
Before we wrap things up, I want to leave our listeners with something to think about. We talked about how those prions can be transmitted through surgical instruments even after sterilization. It makes you wonder, what else might we be missing?
It's a good question.
Are there other, prion-like agents out there that we haven't even discovered yet? What other weaknesses might there be in our infection control protocols?
We need to stay vigilant. Always be learning.
Exactly. The world of microbiology, it's constantly changing. New threats can pop up anytime, so we can't get complacent.
Our work is never done.
Well, on that note, we've reached the end of our deep dive into Creutzfeldt-Jakob disease.
It's been a pleasure.
To all our listeners out there, stay curious, stay vigilant, and keep those microscopes clean.